Republicans think that if you like your insurance, you should keep it. And we mean it.
The focus of this legislation is to take healthcare decisions out of the U.S. Capitol and put them into state capitals. States would be able to keep the Affordable Care Act or reject it, but still have access to the same federal funding available under the ACA.
Plus, what they would receive if they expanded Medicaid coverage under the ACA, whether or not they have chosen to do so.
Senators Cassidy and Collins say their plan would try to expand health care coverage, help control costs, and provide more choices for patients. They talked today about a, quote, default option that would offer basic care with high deductibles. But we're still waiting to see the exact language of the bill to figure out other details. Emily Brostek is the executive director of Maine Consumers for Affordable Health Care.
People who have opposed the ACA because they're concerned about costs, it seems like this would have a similar cost, if, not more, depending on how difficult it is for it to administer.
Bill sponsors are confident that this plan can draw bipartisan support. They'll need 60 votes in the Senate.
Now, if you can say to a blue state senator who's really invested in supporting Obamacare, you can keep Obamacare, but why force it upon us? We think that helps us get to 60.
If they want to get Democrats on board, I think they're going to have to show them that this is going to be better for some reason, that it's going to cover more people, that the coverage is going to be more comprehensive, that the premiums or the deductibles will be lower.
And again, Senator Collins' office just sent out the bill language just a few minutes ago. Emily Brostek, you heard from the Maine Consumers for Affordable Health Care group, says people who want to sign up for the ACA for coverage this year still have time to do so. She also says people who are concerned about changes in Washington should voice their concerns with their congressional representatives. I'm Paul Merrill, WMTW News 8.